Telling that pediatric neurology was just an armchair practice when we started the pediatric neurology. But as of now in 2024, we know that many disorders, because when I started my career as a pediatric neurologist in 1990, I must say that because I started active practice after completing my DM neurology, my colleagues in pediatrics asked me, what are you going to do with pediatric neurology? There are no treatable conditions. But now we have a lot of things to offer. And we know that even for the treatment of cerebral palsy, there are specific treatments are there. And we have various neurometabolic disorders which are treatable. And epilepsy treatment, we know that it has gone into a personalized therapeutic approach. That is the precision medicine. So new drugs are there for various conditions like epilepsy, migraine. We have genetic treatment, and even simple vitamin is used as a therapeutics in many of the neurological disorders. And knowing about the neurodevelopmental advances has also helped us in uh, helping the treatment. And I must say that there is one more thing that has gone just down. That is the preventive neurology also is very, very important, where we can offer early diagnosis and treatment in many disorders. So early diagnosis, early intervention, and the specific treatment is our realm now. So starting with some of the case scenarios. See, there were very evident diagnosis early when a child, so for example, in early 80s or 90s, when such a child is presenting with fever and abnormal movements, with the Parkinsonism features or dystonia or dyskinesia, the diagnosis was Japanese encephalitis, especially when with the setting of in our Kuttanadan area or Alippi region, where the duck rearing is a practice, or in those areas where pig is are there. So with the triad of this an extrapyramidal encephalitis with a typical MRA pattern of involvement of thalamic involvement. With epidemiological support, we could make a diagnosis of Japanese encephalitis, and with just supported by the diagnosis of serum IgM diagnostic of Japanese encephalitis, and this pandasite. And many times people used to tell that there is no treatment for Japanese encephalitis. But I must say that all of you are treating using modern medicine as your practice. Don't use the term not treatable condition, because we all want a cure like uh, pneumococcal pneumonia is treated by penicillin earlier, and nowadays with ceftriaxone. So you want such a cure shot for everything. But when you are managing a dengue, we say that there is no treatment for dengue. And but the alternative people will come with papaya juice and tell that that is the treatment. But what are you doing? You are from the day one onwards, you are monitoring the patient, you are finding out all the parameters that are coming down. Patient is managed with fluid management, their shock management, and other management, and the patient recovers, and they recovers completely. So you are treating and you are curing the patient, but still you will say that we are not treating the patient. But so you have the armamentarium with you, with your correct monitoring, you are able to manage it. Similarly for Japanese encephalitis also, they have initially when they come with the raised tension, you manage the raised tension in a scientific manner. You manage other complications, and ultimately the patient recovers. If they come to the hospital, they will recover. If they don't come to the hospital, they will die. So you are treating, but still you will say that you don't have any treatment, and that is being perpetuated everywhere. And people go to Ayurveda, Unani. Ultimately, they get the credit for the treatment. So that is what is happening. So here onwards, to all my colleagues, I tell that you have a treatment for most of the conditions. You are supporting them, and you are trying to cure those patients. And secondly, again, a diagnosis must be offered to the patient, because again a Japanese encephalitis like patient comes, we will say that the patient is having an encephalitis, we know that, but we will persuade a diagnostic testing to see whether it is a enterovirus, whether it is a Nipah virus or a Japanese encephalitis like that. They will tell them we haven't found out anything, but already the condition is that it is encephalitis and the treatment is same. So, But we will give an idea to the bystanders that you haven't had a diagnosis, and they will always tell you they don't have a diagnosis. But why you are looking for